Welcome to Titatalks. And today we have the unique opportunity to learn more about what is really happening from Dr. Jay Fitch, who's internationally recognized for his leadership as a consultant, educator, and innovator in EMS and public safety. Welcome, Dr. Jay Fitch. Thank you for being our guest today. How are you?
We're good. Thanks for asking.
And how is your family doing?
Family's well, and I'll talk a little bit more about that in just a second.
Okay, and so you're at home in Natchez, Mississippi.
That's right.
Did I
Good.
okay, and tell me, what does your day look like?
Well, my
Start.
daily tasks, in addition to handling client work, revolve around the not-for-profit that my wife and I operate from our farm, called Hoofbeats and Pawprints Rescue. And that program cares for and transports locally adoptable animals
Wow.
that can't find homes locally and would be euthanized. And so, in the past 5 years, we've transported over 7,000 animals to other no-kill shelters in 22 states. And with COVID-19, the transports have slowed down significantly. So our days
Hmm.
are really full caring for, I guess right now we have about 150 animals on the property.
Well, you have the first-hand knowledge as to what is happening on the front lines. Can you tell us some of the concerns and challenges that 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 you
Clearly,
see?
you bet. And we work with emergency medical services agencies, police departments, fire departments, and the personal protective equipment and shortages of other key equipment is really a challenge for EMS. The other thing that we're seeing is that, medics who finish their shift frequently can't even go home. They're exhausted, but they don't want to go home because they're worried about infecting their families.
Tells me that they're not necessarily getting the protective gear that they should have, right?
It's been slow in coming. I think right now everybody's got what they require, but there for a time it was difficult.
Mm. Do you see this getting better or perhaps getting worse?
At at uh, at this point, we have to treat everybody like they're a COVID-19 patient, and
Mm.
so normally we wouldn't go through the amount of personal protective equipment that we do, but at this point in time, you want to make sure that you're safe.
Exactly. What are some of the heroic stories that we can share that you have seen?
Sure. Most frequently I deal with leaders of EMS programs, and one of the real unsung heroes I've encountered is a young man by the name of Thomas Moore, and he is the director of the EMS program at the University Medical Center in Lubbock,
Uh,
Texas. And Thomas and his team, in addition to running calls for about 1,000 square mile county,
mm,
they have been assisting in setting up the temporary triage stations outside the emergency department for the university and setting up additional intensive care beds. They've used a 3D printer to make parts to manufacture ventilators to
wow.
operate up to 4 patients. So they can take a single ventilator and expand its capacity. And then when talking to him last week, he was telling me that he disinfectant was a problem, and so he had done some research on the internet and
Right.
found a local chemical company that works with oil wells and got them to agree to manufacture a disinfectant for them. And
Well,
they then tested it at the university and found it to be so effective they decided to start using it in the emergency department and in the operating room at the University Medical Center. So I guess necessity is the mother of invention, and Thomas and his entire crew are demonstrating innovation. The
well,
medics
that
have, while they are really the tip of the spear, have been a
yeah.
bit forgotten. And one of the things that struck me was for the first time in history, a young female paramedic was featured on the front page of the cover of Time magazine last week, a woman from Westchester, New York. So that warmed my heart and made me glad to know that people were recognizing the work that emergency medical services do.
We absolutely have to recognize the work that the emergency medical services do. Any advice for people that you have for staying at home as relates to staying home and the importance of staying at home and social distancing or physical distancing,
Well,
let's
the
say?
only thing we know for sure is that maintaining that distance and staying home will get us past the most critical phase of the pandemic. But it really also underscores that even at home, we need to be thoughtful about keeping surfaces like appliances, countertops, and one of the most forgotten things is doorknobs. My wife and I, we're walking in and out of the door and realizing that, well, we're both grabbing this door handle, and so we now have Clorox wipes sitting right beside the door.
That's it. And also the phones as well. Most people probably at this point remember the cell phones, but sometimes maybe not. But that's a great reminder. And what are some of the most important takeaways do you feel it's important that we communicate to the viewers?
Well, I think all of us are experiencing some level of cabin fever, and we all want to go back to normal and go back to work at some point. But I would encourage your viewers to pay attention to the medical advice rather than to the economists or the politicians about making your own
Mm.
personal decision when it's appropriate to do so.
And what are some self-care tips that you use on a daily basis with our folks at home?
Well, I think physical but not emotional distance. I encourage you to FaceTime with your family. We started sending short videos back and forth to our 5-year-old twin grandsons that live clear across the country. And in some
Oh,
respects, that's been a real blessing because we probably wouldn't have done that before. Yesterday morning, for example, I was able to show them 9 puppies that had been born overnight.
oh, how
And
beautiful.
they were thrilled. They were excited about the puppies. You know, one of the things that I think is really important, Tita, is that
Yes.
this pandemic has taken an emotional toll on many people. And I
Hmm.
think we have to pay attention to those around us that might be particularly susceptible to depression and or even suicide. Um, distancing, social distancing is particularly hard on those
The
folks.
tips that I also like to share is meditation, just having mindfulness and also reaching out to loved ones. And thank you for sharing what you and your wife have been doing. And you've been such a great inspiration to us. So we want to know who inspires you and what inspires you.
Well, my wife, Kathy, inspires me. Her full-time job is as a nurse anesthetist working in the operating room at our state children's hospital. And that's a
Mm.
really high-risk job. Frankly, she's very fearful of catching COVID-19, but she goes to work every day, reassuring the children that are headed into surgery um, that they're going to be okay. And she does her duty, just like so many of our first responders and caregivers nationwide. And of course, then she comes home and puts in another 40 hours a week caring for the animals with our Hoofbeats and Pawprints rescue program. So I'd say she's my rock and my inspiration.
We really want to say thank you to all of the heroes on the front lines and all of the emergency medical uh, workers and doctors, nurses like Kathy. And thank you for all you're doing for the animals that you're nurturing and taking care of and getting ready for their next homes. Thank you very much.
Oh, you're so welcome. My message to all of the frontline folks is to go back and to think about the 4 pillars of wellness. And it's hard to sometimes do that in the middle of the crisis, but activity, nutrition, rest, and mindfulness are pretty tough for some of them to do. So one of the ways that they can reach out and think about things is like, I love Broadway. I love the music, and I've been inspired by some of the virtual choirs. and hearing them sing. My favorite is One More Day from Les Mis. And that,
Oh, beautiful.
that song really inspires me, and I hope inspires some of my colleagues, that we can all go through this one more day. And it also reminds me that we're blessed, and I'm grateful for the opportunity to serve.
Thank you so much. And thank you also, it's so important, like you mentioned, the 4 pillars of a healthy lifestyle, the exercise, nutrition, the rest healing, and the mindfulness meditation. Very
It,
important as we're coming
it
through
is
this.
absolutely critical, because if we're practicing, good health and wellness, the
Absolutely.
likelihood of COVID-19 being a fatal event goes down significantly.
Absolutely. Absolutely. I think the key is to embracing and using the self-care tools available to us. So on that note, thank you.
Have a great day.
Thank you. You too. Have a great day.